In last Sunday's special report, we revisited 2 decades of Taiwan's fight for inclusion in the World Health Organization after its expulsion in 1972 and replacement by the People's Republic of China. Today, we follow that fight into the present day.
This year, under the unlikeliest of circumstances, Taiwan has fallen into the international limelight due to its success battling the coronavirus pandemic. For a country long ignored, this development may have opened a window of opportunity to finally have a place in the global health community.
As usual, at the 2017 World Health Assembly meeting, Taiwan was again overlooked by the international community. Minister of Health and Welfare Chen Shizhong led a group of activists calling for Taiwan's participation at the World Health Assembly. After scrambling to arrive in time, the group held an international press conference at Geneva, Switzerland, to lodge protests over being excluded.
As you know, we are unfairly blocked. No one should be excluded.
After the WHA meeting kicked off, Taiwan's allies raised the issue for discussion, giving rise to a 2-on-2 debate. They discussed whether to invite Taiwan to attend the WHA as an observer.
I want to ask every member here in this floor why I can sit in this WHA representing 17,000 people while we ignore the 23 million people in Taiwan.
中国中央政府连续8年同意台湾地区。
For 8 consecutive years, the Chinese central government had agreed to allow the Taiwan area under the title of Chinese Taipei to attend the WHA as an observer. This was done on the basis of the One China principle. This special arrangement was arrived at through cross-strait negotiations.
Allied nation Palau spoke up for Taiwan, but met fierce opposition from the Chinese and Cuban representatives. In the end, the issue of Taiwan joining the WHA was excluded from the agenda by the Director General due to China's insistence on the One China principle and its claim that it was tending to Taiwan's health interests.
到了蔡英文就不花了。
After Tsai Ing-wen became president, they stopped sending invitations. That's because if the WHA wanted to send one, it would need China's approval, and China would say no. That's because Tsai Ing-wen said she does not accept the 1992 consensus and does not accept the One China principle.
At the end of May 2017, the WHO elected a new Secretary General. Ethiopia-born Tedros Adhanom Ghebreyesus, in a vote of 133 to 50, beat England's David Nabarro for the position.
All roads lead to universal health coverage. This will be my central priority.
In 2018, the WHA convened once again with an agenda focused on national health insurance programs. Taiwan applied to participate. In the end, due to a cross-strait impasse, it was left on the sidelines.
世界这卫生的巨头们口口声声都提到
The big players in world health kept talking about universal health coverage. After that, they would say, no one left behind. To me, this sounded like the greatest of ironies.
Since Tsai Ing-wen's administration took office, China has been ramping up pressure on Taiwan. It's used generous payouts and favorable loans to poach the nation's allies.
我们的确期待加入 WHO。
We do certainly expect to join the WHO, but this expectation should not be met by trading away the dignity of the country.
In 2019, international support for Taiwan was on the rise. The U.S. House of Representatives passed a bill supporting Taiwan's participation in the WHO. In the same year, St. Vincent and the Grenadines defied threats and violence to speak up sharply on Taiwan's behalf at the WHA meeting.
Taiwan used to be here as an observer in previous times. The only reason why it is not here now is because of the fact that the government in Beijing does not like the current administration in Taipei. Is this right? Should the legitimate health interests of the 23 million people in Taiwan be held ransom to the preferences of a government?
Year after year, Taiwan goes knocking at the door of the WHA. Under intractable international circumstances, these appeals routinely ended up as failures. But then, in December 2019, China had an outbreak of an unknown pneumonia. Soon after, the number of infected hit 10,000, and the number of deaths from the disease soared. The disease spread across the planet, sending the world into a panic. The WHO's every movement was watched very closely by the international community.
Make no mistake, this is, though, an emergency in China, but it has not yet become a global health emergency.
On the eve of the Spring Festival, the WHO held its first emergency meeting in response to the novel coronavirus. On January 26, WHO Director General Tedros Adhanom Ghebreyesus visited Beijing, holding a meeting with Chinese President Xi Jinping.
The identification of the pathogen was a record time, but not only that, the pathogen was sequenced and the genome was shared immediately so that other countries can use it.
Tedros lavished praise on China for its handling of COVID-19, leaving the world astonished. But the epidemic continued to spread. On January 30th, the WHO changed its stance, announcing that the disease had become a global public health emergency. On March 11th, the WHO declared COVID-19 a pandemic.
大家都高度怀疑是不是这位干事长受中国的影响。
Everyone was highly skeptical, wondering whether this director general was influenced by China and was acting to protect China. If China had been identified as the epicenter of the public health emergency or the exporter of this virus, that would have had major ramifications on Chinese tourism and the economy.
China's staunch allies, Russia and North Korea, closed their borders with China early on, fearing infectious spread and weary of disinformation.
中国不仅蛮横打压台湾。
China has not only applied brute pressure on Taiwan, it's also failed to be transparent about many things. It's kept things secret. In reality, the COVID-19 outbreak began in October last year. At the time, China may have believed it was the flu and not a serious public health hazard.
Meanwhile, Taiwan was on high alert due to its proximity and frequent interactions with China. At the end of January, border controls were implemented. People from China, Hong Kong, and Macau were temporarily prohibited from visiting Taiwan.
Taiwanese returning from China, Hong Kong, and Macau are required to fill out health declarations in which they are required to declare their travel history.
Disease knows no borders. As the spread of COVID-19 accelerated, Taiwan added more and more countries to its list of travel advisories.
有一些世界上其他国家不小心听了世界卫生组织的建议。
There were some countries that heeded the WHO's guidance, like Japan. If you hadn't closed your borders early, you saw an influx of sick people from Wuhan and other places in China. They went to Japan.
Then, the WHO released a map showing the worldwide spread of the novel coronavirus. Taiwan was displayed as part of China, triggering misunderstandings abroad. For example, Taiwanese were hit with an entry ban from Italy as part of its blanket prohibition on all flights from Chinese regions. As virus spreads globally, Taiwan was seen as guilty by association.
If
you're unable to demarcate the differences between Taiwanese and Chinese in every field and domain, then you're saddled with the weight of those 1.4 billion people and their negative reputation on the world stage. You have to take on all of that.
As infections spread, many countries' health systems all but collapsed under the tide of patients. Early on, Taiwan had raced to keep infection counts under control, with public health experts and medical personnel working day and night. Their efforts drew recognition overseas.
For the rapidly evolving coronavirus, it is a technical imperative that WHO present visible public health data on Taiwan as an affected area and engage directly with Taiwan public health authorities on actions.
We should not make a geographical vacuum by creating a situation where a specific region cannot join WHO even as an observer.
At WHO meetings, the US, Japan, European countries, and diplomatic allies spoke up in support for Taiwan's participation. It was a ray of hope for Taiwan's long, abortive campaign for inclusion.
And we will have Taiwanese colleagues online, as we will have experts from the rest of China online, and I'm sure they will listen attentively and they will contribute equally to the discussions.
On February 12th, more than 400 experts gathered at the WHO in Geneva for a technical meeting on the development of a COVID-19 vaccine, treatment, and other topics. The WHO agreed to allow Taiwan to participate, but only under the title Taipei and only via video conference. The Taiwanese experts at the meeting were required a confidentiality agreement.
If the WHO were smart, it would allow us to participate in person. But purely from a disease prevention perspective, it didn't make much difference having our specialists there by video conference instead of in person.
Taiwan's former health leaders and lawmakers across party lines are appealing for more than 5 million people to sign an online petition. The petition advocates for Taiwan's participation in the WHO.
有人说这么烂的机构要不要加入？是，的确烂，但还是要加入。
Some people ask, such a rotten organization, do you really want to join? Yes, indeed it is rotten, but we still want to join. Many new viruses emerge and we can't make heads or tails of them. The ones we know about, we have no problem dealing with. But the new ones, we don't know about those, and when we don't know about something, we need to work with the global community.
If the goal of 5 million signatures is met, the petition will be sent to the WHO in May. It will serve as a statement from the Taiwanese people and its government that no matter how treacherous the road, Taiwan will press forward as it has always done in hopes of having a place in the WHO.